Now we're going to move on to lower cross syndrome. So this happens a lot, especially as we get older. We're no longer as active as we used to be, especially for like those that were athletes growing up and then all of a sudden they just stop. That's actually worse than if you weren't an athlete and just went throughout your life without being active, because you've actually trained your body, built muscle, got in shape, and then just, now everything's just tightened right up. So you're actually in worse shape than if you hadn't been. So we've got to work on this. We can fix this. What this is going to cause: weak core, weak glutes. You ever see that old man in the store that has no butt, just flat, and a beer belly? That's pretty much an example of what we're talking about. But what happens is you get weak in the core, weak in the glutes, but you get really tight in the low back, and you get really tight in the hip flexors. Okay? So this is going to cause faster degenerative changes in your low back as well. So we really want to work on stabilizing the core, strengthening your glutes, and stretching specific muscles. Hip flexors are the big one, but also your hamstrings and your erectors in your low back. So what this causes is altered hip biomechanics, SI joint dysfunction, which most everyone in this office has SI joint dysfunction, low back pain, and knee and ankle dysfunction, because everything that messes up here is going to work its way down. So this is common with people who have a sedentary lifestyle. They sit too much for their work, working at a desk, people who drive for a living, and then just our elderly generations that aren't as active as they used to be. So I put this in there just to kind of show you how the body works. So each joint actually works in connection with the next one. So for instance, your shoulder, very mobile joint, lots of ranges of motion, okay? So that joint's meant to be mobile. So the very next joint is a stability joint, your elbow. It can only flex and extend. It's a stable joint. So what does it mean the wrist has got to be? Mobile. They go in recession. We've got all that movement. Let's say I hurt my wrist and that goes really stiff and tight. What's going to happen to my elbow? It's going to go mobile. It's not supposed to be mobile. That's how we lead to injuries in the elbow. Let's say the elbow goes mobile. What's going to happen to the shoulder? It's going to stiffen up. We're not going to have as much range of motion. That's going to cause the neck to start to become too mobile and shift. So everything works together. Ankle, mobile. Knee, stable. Knee becomes unstable. We start having ankle stiffness. Can't move our ankles. Can't roll our ankles. The hip, same thing. Mobile joint. Let's say the hip. We have a hip injury. We can't move it. What's going to happen to the knee? It's going to go unstable, and then all of a sudden we're having knee issues. That's how people have meniscal injuries and all that. So what does that tell you? Well, it kind of tells you that if you keep stretching and mobilize your hips and mobilize your ankles, there go most of your knee issues. Same thing with the shoulders and the wrists. Keep those mobile, there go your elbow issues. And they also connect to the spine. So you keep your hips mobile, helps stabilize your low back. Stable low back leads to a mobile mid-back. Mobile mid-back leads to stable up here. So everything works together. So what are the most common weaknesses with lower cross syndrome? Glutes and your abs. We kind of talked about that a second ago. But what happens when your glutes actually go weak? So again, remember how we talked about when your pecs go really tight, you get neurological weakness in your rhomboids and middle traps? When your glutes go weak, you're prone to being hypertonic and really tight. When they're turned off, the hamstrings, the piriformis, which is the muscle that lies over your sciatic nerve, that's a big one. Your quadratus lumborum, that's the muscle that attach at your hips and run up and attach at your ribs. Your IT band, the one that runs down the leg and crosses over the knee, and then your thoracolumbar fascia, the fascia over your mid to low back. When your glutes go weak, every one of those go tight. They try to overcompensate. So that's what's going to cause sciatic issues, hip flexor issues, hamstring, IT band, which is going to cause hip and knee problems. So a lot of things happen when our glutes go weak. What about with our abs? When your abs go weak, it comes with tight low back muscles. And so we kind of all work together. So this is a big one. One key to rehab your low back pain: strengthen your abs and stretch those muscles that are going to tighten up. So I know a lot of you have seen these tools we have laying around the office. These are Wobble discs. You're encouraged to use these while you're here in the office, especially if you're having to wait on an adjustment, or if after you've been adjusted, you're more than welcome to come and sit on them. What this is going to do is just a sacral exercise. Your sacrum is the very foundation and base of your spine. Kind of looks like a fist in the base of your low back. I'm sure if we've shown you your x-rays, you can kind of see that at the base of your low back. So what this tool is going to do is going to help mobilize the sacrum to open up the SI joints and relieve tension and stress in the low back. So it's also going to help actually with your cerebral spinal fluid pumping system back up to your brain. So your sacrum is your pumping system for your cerebral spinal fluid. So you get that sucker moving, your whole spine is going to be better. It's going to help rid the brain of toxins, also while replenishing the brain's cushion barrier, protecting it from harm. Kind of sounds important, right? We've got to have a mobile low back to help with the brain. So again, this is going to increase the body's parasympathetic tone and helps you hold your adjustments longer. So I really encourage you to use these tools. The great thing about these tools, they don't take a lot. So you're going to sit on it. You're going to go back. You're focusing all your movement in the sacrum. So I'm going to flex back. I'm going to flex forward. Back, and I'm sitting on it the whole time while I'm doing it. So basically, pretend it's there, but the whole entire motion is here and then back. And you're going to do 10 each way, and then also side to side. Again, I'm focusing all the motion here, so you're not seeing it, but you're feeling it, right? You're going to go 10 each way. And then the last one, which most of you, I've been told is embarrassing, but I don't see it as that because this is a doctor's office. But circles, okay? So when you're going to sit on it and you're going to mobilize. So we're focusing all the motion here. So it's just circles. We're going to go one way 10 ways. You're going to go the other way 10 times. Okay? I'm focusing all the motion down in my sacrum. So, if you think people are going to stare at you and laugh at you, that's okay. I'll do it with you. That's perfectly fine. You can tell them you're helping your brain and your low back. So you'll be smarter than they are. All right, we'll skip that. Okay, so I kind of put that in there, but we don't have to talk about that. So what I wanted to kind of go over was the way to properly train. So I know a lot of you, we talk about, have you been doing your stretches and exercises? How many of you heard me ask you that question? Yeah, I usually ask most people that question, especially when I'm feeling it, like, tight muscles and that kind of thing. So the key to proper exercise and actually strengthening and healing your joints is to work in a specific order. We want to get mobile first. Okay, that's why I'm a big, I love yoga. Okay, yoga is going to be great. So what you're doing mainly with that, the key to that is mobilization. Because mobilization leads to stability. So we want to kind of work in that area. So we want to start focusing on mobilizing first. So a lot of stretching, yoga, things like that is a proper way to actually heal the body, especially if we're having a lot of joint issues. And let's say when you exercise, it hurts. I can't lift anything, I can't run, those kind of things. Okay, well, let's start at the base. Let's start stretching. Let's start mobilizing these joints. So we want to get movement before we start getting strength. Because if you're not mobile, you're actually having a leak of that energy anyways. So we want to stretch and get mobile first. The key is actually to get mobile, which leads to stability, and then stability leads to strength, and strength leads to power. So, why is it so important to stretch? Well, this is going to correct muscle imbalances, increase your joint range of motion, decrease those tight muscles, relieving your joint stress and pain, improve extensibility of your musculotendinous junction. What that basically means is you're going to have the ability to where, let's say I stepped in a hole and I kind of tweak it, but I catch it kind of thing. I'm going to have more give, more play, more, my body's more aware. My body's able to not tear. It's still going to hurt, but you're going to be able to heal faster, and you're not going to have as severe of an injury when you're doing more mobility training. It's also going to help maintain a normal functional length of all your myofascial structures and improve and maintain optimum neuromuscular efficiency and function. Big way of saying it's just going to keep your nervous system open. okay? Because when we have tight muscles and things like that, it's impinging upon everything. Those tight muscles aren't just tight muscles. They're also preventing your blood flow from being where it should be, lymphatic drainage, and neurological flow. So by releasing the tension in the muscles, we're actually helping all of those. So how can we fix lower cross syndrome, like we talked about? Well, we know the weaknesses are in the abs and the glutes, right? So that's what we're going to be strengthening first is a pelvic thrust, or what we call a bridging exercise. This is how you're going to start. You're going to lay on your back, hands by your sides, palms down, feet flat. And this is the exercise. You're going to, before you do any kind of movement, this is where you start. The next thing, before you ever even think about doing this, you're going to tuck your chin, tighten your core, and squeeze your glutes. The reason we do this is because we want our brain focusing on specific areas. We tuck the chin, that's going to cause it just centers your body and protects your neck for one thing. But then you're going to tighten your core and squeeze your glutes, so when you do this exercise, your body's actually focusing on stabilizing those specific muscle groups. Usually when you do these, you're going to again hold for 2 to 3 seconds before you come back down. So you're just wanting to get your body flat. So you're basically just squeezing your core and glutes, and then you're just bridging up. You're kind of thrusting your pelvis forward till your body's flat, and hold for a few seconds, and then go back down, and that's the entire exercise. Again, same thing, 3 sets of 8, and work your way up to 3 sets of 12 to 15. The dead bug, very simple exercise, it seems like. It's more of a neurological trainer. You basically start here, you look like a bug that just died, that's why I call it the dead bug. So what you're gonna do is it's alternate arm, alternate leg motion. What that's gonna do is actually gonna train your brain. So you're going to start there. So when you're there in that position, you can pretend I'm lying on my back, you're going to go right arm with left leg, left arm with right leg. So when I go to extend, it's here. And then I come back, and then the next one here. And then back. And the whole time, what am I doing? When I get to the position, what am I going to do? I'm going to tuck my chin, tighten my core, squeeze my glutes, then go through the exercise. Every single exercise you do for the low back and the core, you're going to tuck your chin, tighten your core, and squeeze your glutes before you ever start. Again, we're training the brain to focus on specific muscle groups. You also notice he doesn't touch his leg to the ground or his arm. That's part of the exercise. We don't want to just lay him on the ground. You're not really doing anything at that point. It's stabilized. You're going to go just before you hit, and then back to the starting position. So you're training your body to have proper movement pattern. You notice when you walk, it should be, see how you went right arm with right leg? That's improper. It should be opposite arm, opposite leg motion. That keeps your body in a perfect rhythm, cross body rhythm, which prevents falling, helps improve proprioceptive awareness of where your body's at in space. So it's important to do cross body type exercises, again, to just keep your brain to body connection working better. So I threw this one in there. You can do a dead bug if you want to on a long foam roller. It's just going to help improve the mobility in your mid-back. If you have a lot of mid-back mobility issues, you can do that on a foam roller, and that can help mobilize your thoracics. So the cobra, has any of you done this exercise before? Yeah, especially I do this a lot in yoga. Again, I recommend you don't really start off just coming straight up like this, especially if you're having low back issues. This is a good way of kind of just opening up and tractioning your lumbar spine. I recommend you start off just come up on your forearms, and you're just breathing and relaxing. And then eventually you can come up on your hands with your elbows bent. And then lastly, you can come up on your hands with your arms extended would be the last stage of it. But always start off slow, again, work your way up. But then this is just a way to open up the low back and help with low back issues. So the bird dog would be next. That's basically the exact opposite of the dead bug. Notice if I were to invert her on her back, it's the same exact position. So we're going to do the same thing. Opposite arm, opposite leg motions. Again, this one even tells you, tuck your chin, tighten your abs, tighten your butt, and then we're going to go through the exercise. Opposite arm, opposite leg, till they're straight, back down to the starting position, and then the opposite side. And again, make sure you're tucking your chin, tightening your core, squeezing your glutes before you do the motion. Wall squats. So this is a little bit more advanced. If you can't do this one, that's okay. I also recommend, if you're a little worried about balance or falling or anything, put like one of those big exercise balls under you, or a stool, or even a chair, just so you can get used to it. But you're simply going to start, you want your legs out to about to where you feel like you could sit. You know, or if you went all the way level, your feet will be flat at a 90-degree angle. So that's about how far you want your feet to come away from the wall. And then you're just going to simply tuck your chin, tighten your core, squeeze your glutes, slide down the wall slowly till you're in a seated position, hold for a couple seconds, and then slide back up the wall to the starting position. Simple, yet very effective exercise, but it's also going to help with balance. So, but again, if you're worried about balance, worried about falling, make sure you put something under you to start with. So, we talked about fascia, we talked about things you can do, you can use. Now we're going to go into them. So, a foam roller. So this is for fascial release, for improved joint function, pain management, as well as lymphatic drainage, blood flow, all that. So remember we talked about those specific muscles that kind of take over when your glutes and core go weak? Those are the ones that we may need to break up fascial adhesions in. This would include the IT band. Your IT band, again, runs from above your hip to right below the knee. Large muscle is a double joint crosser, so when it gets really tight, it can affect your hip and your knee. You never want to foam roll or use a TheraBall over a joint. Again, repeating that because that could damage the joint, cause you a lot of soreness, bruising, that kind of thing. We don't want that. So you always want to start right below the joint, and you're going to roll to right above the next joint. So your zone, if you don't know where your hip bone is, little trick, turn your toes in and out while holding your side. You'll feel that ball roll, and you'll feel it. You want to start right below there. And you're going to roll from here to right above the knee. So that's your zone that you're going to roll in. You're going to lie on your side, foam roller position here, stabilize on your elbow, and you're just going to kind of walk your way down the mat, letting that roll. Again, just like we talked about with the ball, if you feel a tender spot, stop and sit on it for as long as you can, up to 30 seconds, and breathe. Never hold your breath when you're foam rolling. It's a good way to cramp and cause yourself more issues. Once you've laid on it for as long as you can take it, or up to 30 seconds, continue to roll until you feel the next adhesion. Sit on it again. You're going to do that all the way down. Once you've cleared all the adhesions, then if you want to, you can do what some people do and just roll on it. The rolling is good, but it's not going to break it up. It's actually the sitting on it and putting that pressure and breathing that really helps the body let it go and break it up to go along with the rolling. But that pressure and that breathing and sitting on it is really key. Hamstrings. You can do these both at the same time if you want to. Again, you're stabilizing back. You're going to roll from the bone that you sit on to before you get to the knee. Again, don't roll over a joint. Stay on the hamstring muscles. Psoas. So this is your hip flexion. So this is the groin muscle. It runs in the groin, wraps all the way around, and attaches at your low back. So when your glutes and core go weak and that sucker tightens up, what's it pulling on? It's pulling on your low back. Or if you sit too much and you're in this position, this muscle's relaxed, it's now tight. So what are you doing the whole time you're sitting there at your computer? You're pulling on your low back because this muscle's contracted. This is a very large muscle. This allows you to lift your leg. This muscle is responsible for a soccer player being able to kick a soccer ball 90 miles an hour. It's a very strong muscle, okay? So we really need to work on rolling this out too. However, this one does not feel good. No. Okay? So this person is very brazen and they're using a phone book to dig it deeper into the psoas muscle. So you're basically going to find the pubic bone and the front of the hip, it's right through there. And you can, I don't use a phone book. I'll just lay on the ground, kind of roll that out through that area, right there in that groin area. And then you'll also want to work kind of this zone too if you want to. But for that zone, I just use a wall. and I'm just going to lean. I'm going to roll. I'm going to find anything if I do. Just sit there and breathe to you up to 30 seconds. Piriformis, again, this is the muscle that lies over your sciatic nerve. So when this one tightens up, it can cause you a lot of problems. So for this muscle attaches at your sacrum and runs across at an angle down to your hip. So it's here. So that's why she's actually sitting the way she's sitting on that foam roller, because she's using that bent leg to help her to put the pressure there. So it's the leg that's bent is the side that she's working. Okay? So she's stabilized on her hands. She's sitting on it, but kind of rolling forward a little bit, and then putting this leg across that knee to kind of put her at an angle to roll that out.